A very good evening to all of you. So today we are again here for the Organon class. So today we have done till aphorism 184. So today we'll start with aphorism 185 and we will go up to 190. Today we'll do 6 aphorisms. Today we will be talking about local diseases, the diseases which are related to the skin. So what are the diseases which we call as local diseases? How they are one-sided? Because now we are under the subsection of one-sided diseases. So first we have done one-sided diseases, how to see them, how to tackle with them, what is one-sided diseases. Now the sub part of one-sided disease is the local diseases. So among the one-sided diseases, an important place is occupied with the so-called local maladies, by which term is signified those changes and ailments that appear on the was that these parts are alone morbidly affected. Not up to the time of Dr. Hane, but even today also. This idea is still there in the mind that the outer part, the skin part, is not the connected with the inside. If something is happening on the outer part, on the skin, then skin is basically diseased. The person or the internal part is not diseased. This idea is still there. And that is why we have so many ointments, so many medicated creams which are being given even for day to day things, like for example the acne. There are acne tapes, there are acne creams, corn tapes, very, and they are being sold. The people are using them. Even the people, when some patient with skin disease, it comes to you as a to a homeopath, and when a homeopath starts telling them that this is something which is coming from inside, you can never cure it by applying anything on the outside. It is related with the inside. Even the patients, they become very surprised that that is it a disease, how is it related to my insides, how is it related to my rest of the body? Because that have been feeded to us that when a skin is diseased, is the local part which is affected, and you just do something on it. If there is some dryness, apply some oil. If there is some rash, apply some cream. If there is some burn, apply something on it, and it will get better. But the connection between the sora or the miasm or the inside or the vital force, we never see that. And that is the most biggest of the blunder which a physician can do. Dr. Hahnemann will say the same thing when we go forward, that it is a blunder, because this is from where it all starts. Skin is a very important part of human body. We'll just go off the organ. We'll just try to understand the skin. What is skin basically? If you try to go a little deep inside the study of the skin, what is basically skin? Skin is the oldest mental part of our body. If you think about it, when there was a single celled organism, even now, if you take a cell, the nucleus is not the brain or the main part of the body. It has been told to us, nucleus just keeps a control over the DNA and RNA, but it is not the brain. The membrane is the brain of the cell, the outer membrane. And there have been these experiments where they have done that in a cell, they took a cell and they took out a nucleus of the cell, and the cell was able to survive for a longer period of time. It was not able to do because of the absence of DNA or RNA. The cell was not able to repair itself, so it died a slow death. But it was not something sudden. It was not something that it was not able to do its functions without the absence of the nucleus. But then in a cell, when they took out the cellular membrane, the cell immediately died. It immediately collapsed. Because the membrane, we have an inner world behind this skin, and then we have an outer world on this part of the skin. The skin is the part which basically joins the both. Even our other senses, the eyes, the ears, our nerves of the hearing, our nerves of the smell, our nerves of the taste, they have all originated from the skin. You can say that those are the super special senses which have arisen out of the skin. So they have the similar function. It basically connects your outer world to your inner world. Now, if we go more deeply, we have talked about skin earlier also, because when we go into the GNM, that German New Medicine part, it gives it that they give it as a separation conflict, which basically starts affecting the skin. But over a period of time, although I have talked about that thing in my workshops or lectures, over a period of time, when I have started understanding it more deeply, it is more deeper than a separation conflict. It is more deeper. If you try to understand, this part is basically forming your reality. Whatever you are feeling, these senses, they are basically forming your realities. Whatever I am feeling, whatever I am watching for, inside me, I don't have any problem. If I close my eyes, if I close my ears, if I just take off my this sense of smell, or I when I'm not connected with the world, I don't have any problems. You just close yourself in a room where nobody can disturb you, where nobody can come, and you just close your eyes and you go more deep inside. After a while, you will, after 10 or 15 minutes of that state, you will start even forgetting yourself, where you are sitting, who you are, and you will be into a different kind of bliss. The people who meditate, they can relate with that thing. And that is what is the meditation, just taking yourself away from this reality which we have formed, which we call as the mind. The whole formation of the mind is because my eyes are open and my skin is exposed and my senses are exposed to this outer world. From there, my mind is being developed. So this first part, the skin part, is the first part of our sensorium, of our reality, of our perceptive brain, of our perceptive mind, whatever perceptions I am keeping. So when you see from this point of view, all the hurts, all the sensitivities, everything is because of this organ. So obviously it should be the first part which will be getting affected. That is why Sora, psychosis, syphilis, all the three miasms, when they start from the skin. That is our first defense. That is my first part which is getting affected by the outer world, because in my inner world I don't have any problem. Whatever I am getting the impressions, they are the impressions of the outer world. If I'm getting humiliated, insulted, if I'm getting anxiety, fear, they are all coming from my perceptions. Inside me, I don't have anything. If a child is afraid of dark, he has somewhere picked up that something is there in dark which can hurt him. If a person is afraid of talking in the front of public, or talking in a class, or giving an interview, he has sensed something, he has taken some impression that during an interview or talking, he might get humiliated or something, might be asked which he will not be able to answer. He has picked it from the outside world. So this connection which we have, it is more deeper than the separation conflicts. So if we understand in that way, we can see that this is the first mental organ which we have. This is the first organ which is directly connected with my mind. This is the part from where my learning mind basically develops. All that I have learned, whether right or wrong, it has been because of this part. It is always there. And that is why it is very commonly affected part, the skin part. No one in the world can say that somewhere in their life they have not gotten any kind of skin problems, even for a little time, even for a smaller time. They always had, because without affections on the skin, the chronic disease cannot start appearing. They cannot come. The sora cannot develop, the psychosis cannot develop, the syphilis cannot develop. So whenever we are looking at the patients who are suffering from skin disease from a longer time, we have to see more deeply that how this connection with the world, the internal and external connection, how it is basically getting affected. We'll talk about when I'll give you a few examples also, and we will talk about that thing when we will go into the this how to cure the, because that will start from 190 onwards. Today we are more into understanding of what the local melodies are. I wanted to give this impression about the organ of the skin, this understanding of the skin, that how it is a very primitive organ also, and very important till now. Even now, it is the most important of the organs. Although we have many vital organs on where our uh, life depends, like our lungs, our heart, our liver, kidney. But I think skin is the organ, or our senses are the organs from where we are connected with whatever we are connected with. Without that, we cannot be connected. So till now, the idea prevalent in the schools was that these parts were alone morbidly affected. Now you try to analyze that whether whenever the skin is affected, only skin is affected or the whole should be affected. Now you can get the idea that how without the affection of the whole, the skin can get affected. So now that idea will look more prevalent, more absurd, that how it can happen, because the skin is basically related with the whole, and that the rest of the body did not participate in the disease, a theoretical absurd doctrine which has led to the most disastrous medical treatment. And because of this idea, the treatments were invented which proved to be very disastrous for the human being, because until and unless we understand this relation with the whole and the skin, and we take it inside, we feel that thing inside, this kind of treatment, then it starts looking that this is a very wrong treatment. If we need to cure the skin, the whole needs to be cured, because without the involvement of the whole, the skin cannot get affected. Aphorism 186. Those so-called local maladies which have been produced a short time previously solely by an external lesion still appear at first sight to deserve the name of a local disease. So some local maladies which have just recently started, it might appear that uh, right, it might appear right to call them local. For example, a mosquito bite, we will say okay, it is a local disease, it will heal on its own. But then the lesion might be very trivial. So in that case, the lesion might be very trivial, it might be a lesion which will heal on itself, and in that case it would be of no great moment, it will be not a very great characteristic when we call it that. For in the case of injuries, but when there are cases of injuries, now that is the second scenario of the local diseases, because when there is some blunt trauma, or like insect bite also, or any other kind of injury which is happening from the outside, accruing to the body from without, it is happening from the outside, the injury, if they be at all severe, the whole living organism sympathizes. But in that case also, if the injury is very um, deep, for example, there has been some blunt trauma, So it is not the only skin that is painful. The whole body, the whole organism feels that pain. It sympathizes with that. It feels that pain. There might even occur fever. For example, the fever, now fever is something which the whole body is feeling. It is not only that particular organ or that particular part which is feeling. So the treatment of such disease is relegated to surgery. So if there is some injury where a surgery is needed, for example, there has been some fracture or some breaking of the skin has happened, which is beyond the scope of some medicine, like some stitches are needed or something, where the lips have to be brought, the skin has to be brought close. So those treatments must be done at that time. Okay. So the treatment of such diseases is relegated to surgery, but this is right only in so far. Now, Dr. Hahnemann has given this thing here, okay, that it falls under the surgical part, but there are few conditions where you have to look only for surgery. And he is saying what this is right only in so far as the affected parts require mechanical aid, whereby the external obstacles to the cure, which can only be expected to take place by the agency of vital force, may be removed by mechanical means. So the surgery should also be done as an, so that there is no obstacle to cure, because the actual, if there is something which has happened, for example some fever has happened, for example after that some, so that fever has to be cured by an agency, by a medicine which can act on the vital force. So we have to give a homeopathic medicine for that. But to cure that, if there is something which requires to be done in the form of surgery, that should be done first, and then a homeopathic medicine should be given so that it can take care of the whole. For example, by the reduction of dislocation, if there has been some dislocation, for example there has a fall and the shoulder was dislocated, so it has to be done surgically. The dislocation should be reduced by bandages to bring together the lips of the wounds. If there has been some cut, some wound, and the skin has opened a bit, then some stitches or some bandages should be used so that the lips of the wounds, they can be bring together, they can be closed by the extraction of foreign bodies that have penetrated into the living parts. If some child he has taken in the coin, or some injury was there, and some iron, piece of iron or something has gone inside, it has to be removed. Some foreign bodies, they have to be removed by making an opening into a cavity of the body in order to remove an irritating substance. If some irritating substance has gone inside, so some cavity, if there need to be make some cavity, if there is need to make some to do some surgery to remove that, that should be done. But something is going from outside inside, or to procure the evacuations of effusions of collection of fluids after some injury, or after this some kind of fracture, if there is some effusions, very prominent effusions which have happened, we have to evacuate them at that time. But now we have to see this. Dr. Hahnemann has not told this thing in the this diseases which are coming from inside, for example ascites or pleurisy. He's not talking about that, that those effusions need to, they, this is because of the injury from the outside. Some mechanical injury has happened, after which the this effusions, for example some injury from outside to the chest, and then it has happened by bringing into the apposition the broken extremities. If there are broken extremities, we have to bring them together, we have to place them back, and retaining them in exact contact by an appropriate bandage, etc. But when in such injuries, the whole living organism requires, as it always does, active dynamic aid to put it in a position to accomplish the work of healing. For example, when the violent fever resulting from extensive contusions, lacerated muscles, tendons, and blood vessels require to be removed by medicine given internally, or when the external pain of scalded or burnt parts needs to be homeopathically subdued, then the services of the dynamic physician and his helpful homeopathic come into requisition. So whenever such kind of great injuries, match injuries happen, the whole gets affected. There might be some kind of fevers which are coming. There might be some strong pains which need to be cured, and the whole living organism is affected by it. So it needs some dynamic aid to get that thing cured, because whenever we go into state of injury, such injury, the shock of the injury to the body, it affects a lot. I've seen so many cases where the injury on a particular part has not affected that much, but the whole got affected because of that shock of the injury. There was this lady who was working, and suddenly, because of some error in her movement, the boiling water, it was she it fell on her from the vessel, and the whole body was scalded. So they took her to the hospital, and they were doing something, like they gave some first aid and everything. But that lady, she started going into spells of fainting. She would faint, she would become conscious, then she would faint again, then she would become conscious, then she would faint again, then become conscious. And for then she started having fever, and then delirium came, and even in delirium she would faint and become conscious, faint and then become conscious. This was going on for 3 4 days. And then they contacted me. We talked about her, I saw her video, and I think we gave her camphor. I think, and she started getting better after camphor. She got so better that even her skin, the doctors were, they were amazed at how these scars are becoming better so quickly, that we have never seen it become so quick. And I have seen so many cases. There was another lady whose this fingers, she was doing something with the grinder, and her fingers, they got into the grinder, and she started having this delirious fever afterwards, and she got cured by one of the medicines. I think she was given opium, I think. So many cases where an injury, and injury can never happen if a injury is strong. It can never happen that the whole does not get affected by it. So there you will always need a homeopathic remedy, so that the rest of the part can get, after the surgical part, after they have done some stitches, after they have done some and the first aid has been given, you will always require some homeopathic remedy if the injury has affected the whole organism. So this is the first part of the local disease. Now the second part. But those affections, alterations, and ailments appearing on the external parts that do not arise from any external injury, or that have only some slight external wound for their immediate sighting cause, are produced in quite another manner. But those things which are not produced by the external injuries, or there was a very small external injury but it became into a chronic local disease, those things, they happen in completely another manner. You will see that some internal malady, some internal miasm is behind their origin. Their source lies in some internal malady. To consider them as mere local affection, at the same time to treat them only or almost only as it were surgically with topical applications, as the old school have done from the remotest ages, is as absurd as it is pernicious in its results. So Dr. Hahnemann says that to treat them in that manner, even the first one, the first local disease where the injury is happening from the outside, okay, we definitely know that the causation is from the outside, but still the whole is affected. The whole organism got affected by it. So where the cause is also internal, where the skin disease is coming from, cause which is going on internally, from where there the skin disease is coming. So there we cannot even expect that a simple local remedy or some single local topical applications, they can cure that disease, because here the cause is also internal. We have to give some medicine which can cure that external internal cause. And that is why you know uh, the skin diseases, they are the most difficult ones to cure. There is this some doctor, he told me this thing long back, some that where that when some colleague's child, he wanted to do some specialization. So one of the doctors, he was telling that, be a skin doctor, because once a patient comes to you, for whole life he will be your patient, because they are so tough diseases that they will not get cured by this kind of treatment. They will always remain like this. And I have seen so many I recently I had and quite the other ways in with the homeopathy. I recently we had this woman who was working for us, and she got talking to my wife, Dr. Vidya, that she has been having this, abscesses from 8 9 years around her thigh region, and they have never got cured. She has used so many ointments, so many creams. She also took some kind of injections, some steroidal creams, and even now she was using some, because it happened in the inner part of the thigh, and they would become quite painful, and she could not work, she could not walk, it was very difficult for her. And after taking her case, Dr. Vidya, my wife, she gave her Natrum self, and she was astonished to see that within I think 12 or 15 days the whole thing got cured. First, she's reported after 5 or 6 days that now there is no pain. They were so painful and itchy. Now there is no pain. There is still some swelling which has decreased, but now there is no pain. And after more 5 or 7 days, it was completely gone. And now I think it has been 3 or 4 months. The blackishness, the blackness of the skin, it is also getting better. The skin is becoming healthy, because the main thing to see in the homeopathic cure when we take the follow up is that it should not be that it has suppressed for some time. It should not be there. We have to see. So the best way to see that skin is becoming of normal color. When the skin starts becoming of normal color, we get a surety that okay, now the disease is getting going away. Because in most of the suppressions, or most of the temporary ameliorations, what will happen is that the inflammatory part will get better, but the skin color, it remains same. Like if it is blackish, it will remain blackish, and if it is hard, it will remain hard. So once the texture and the color of the skin starts becoming, then we know that the real cure is getting going on, because then the part is becoming healthy. Only not only the disease is gone, but the part is also becoming healthy. So she was also surprised. She was thankful also that I have been suffering from this thing from 8 to 9 years, and I could not imagine that any medicine can cure it so fast. That earlier also it would get better, but it never got better in this way, where patient, they can judge the difference, the amelioration which was temporary, and the amelioration or the cure which is going on a more permanent level, because the whole is getting better. So the patient can basically see the change. And she then again told that for the first time, like in this 1 week, the last 1 week which she was getting better, that for the 1 week I have not been angry on anyone. I don't know, I am more happy, I am more energetic, and I could not find any reason to be angry. So when the cure is going on, when a right remedy is given, you can see the minute changes. The patient can also feel that I was getting angry on people. So the whole starts becoming better, because the disease is coming from that hole. So when we consider using some topical application, some, now that is why Dr. Hahnemann has used absurd, that it does not make any sense to use such kind of treatment, and the pernicious, because once the disease starts getting suppressed from this part, or once it is maltreated from this part, the only way to get affected, or the only part which will start getting affected, is the inside parts. the internal membranes, the internal organs. So it is pernicious, it is dangerous in its results. Many times the skin diseases, they change from the more simpler forms to the more complex forms. Uh, Recently, I had this lady who is suffering from psoriasis from past 20-25 years, I think. So now when her psoriasis is becoming better, her old kind of eruption, she had used to have small eruptions, very vesicles, very small vesicles. She started having them back. So when I asked her that, and are they, are these problem, this is more problematic, or the psoriasis was more problematic? She said, she immediately said, oh, this I can bear with. This is not giving me any problem. They are very slightly itchy, and they are not causing me trouble whole day. It is just some part of the day that they itch. I just itch it a little bit for a few seconds, and that itch is gone. So even the patient can make that this is something else. It is not the that disease which I was suffering from, which was more violent. So coming to aphorism 188, these affections were considered to be the merely topical and were therefore called local disease. So Dr. Hahnemann wants to, through these aphorisms, he wants to tell a homeopath, he wants to tell a physician that you have to get separated from this old learning, from this old thinking, where we have always thought of these affections to be local and not connected to the whole. Because on the contrary, when you see it more carefully, that this, whenever the skin gets affected either from internal cause or from the external cause, the whole is always affected. It is always affected. When a person is itching on a part and is a very violent itching, the whole person is affected. It is not only this part of the wrist or the hand. This boy who he came to me, and he stays in England, and he had come to India. Both the brothers, they had skin diseases. So the mother was telling about this boy, around 15-16 years old boy. He cannot sleep in night. Sometimes it is whole week that he cannot sleep. So how I can say, or how someone can say that this is just a mere local disease? It is not affecting the patient. It is just on the skin. His sleep is getting disturbed. His day-to-day routine is getting disturbed. How can it and only be called a local disease? So Dr. Hahnemann wants us to, get away from that kind of thinking and start understanding that these local diseases are part of the whole. They are not something separate from the whole. So that we do not go again doing the same mistake of treating them some different disease and not affecting the organism, as if they were maladies exclusively limited to those parts wherein the organism took little or no part, or affections of these particular visible parts of which the rest of the living organism, so to speak, knew nothing. So he said that these kind of diseases, these local diseases, these skin diseases are being treated as if the rest of the organism does not know about that part or that disease, that they are just visible outside, and it has nothing to do with the inside. So here he says in the footnote that it is one of the many great and pernicious blunders of the old school. And yet, very little reflection will suffice to convince us that no external malady, not occasioned by some important injury from without, can arise, persist, or even grow worse without some internal cause. So he says that just a little thinking, you just sit back and you start thinking about this part, that from what is the function of the skin, how it is related to my inside, and you can come to this thing that without the disturbance of the inside, without some internal cause, this part or this external disease or this skin disease, it cannot come. Without some internal cause, without the cooperation of the whole organism, which must consequently be in a diseased state. So when skin is getting diseased, that means the whole organism is basically in a diseased state. It could not make its appearance at all without the consent of the whole of the rest of the health and without the participation of the rest of the living whole. So the skin disease or some appearance, even a smallest of the rash or eruption, which coming which is coming from no external cause, it cannot make its appearance until and unless the whole agrees with that thing. Until and unless that state of health agrees that we need this kind of rash or this has to be produced of the vital force that pervades all the other sensitive and irritable parts of the organism. Indeed, it is impossible to conceive its production without the instrumentality of the whole deranged life. Whenever the life is in a state of derangement, I just love few words which Dr. Henneman uses, the deranged life, whole deranged life. When the life is in a state of derangement, when uh, there are some things, not my life, but the life around me also and mine also, because the life is interconnected. Life is not a singular, some different entities, it is a singular thing. We all are interconnected. For example, if someone is sick in our home, that thing is basically rearranging the life around that person also. The person who care about that person, the person and the people who are in any kind of connection at different levels, they feel that derangement. So when the life is deranged, when we are taking in things from the outer world which are basically deranging that flow of life, we all have that healthy flow of life. And when that gets deranged, when we pick up the things, when we take in the things which we are sensitized to, from there these kind of things they start. And it is impossible to understand, it is impossible to to get that thing, that the skin disease or these kind of eruptions or the some rashes, they will erupt without the whole deranged life, without the life, the whole organism getting deranged. So intimately are all parts of the organism connected together. All the parts of the organism are interconnected and we call that as whole. They are so interconnected together to form an indivisible whole in sensations and functions. So we are whole in our sensation and function. It is inconceivable, it is impracticable to think that one part is getting sick and the other parts don't know about it. It is very impractical thing to think. If someone pinches me here and my other parts don't feel that pinch, how this can happen? When someone pinches you, with a more force, your lips and your vocal cords act and ah, we say that thing. So the information went to my vocal cords, the information went to my tongue to bring out that I am not feeling good about this thing. If some mosquito bites, the other hand will come and slap there. So this is not a local problem, it is affecting the whole part. If my right hand didn't knew what is happening on my left hand, how it will come in the defense of the left hand? So we are whole, and we have to understand that before going more further into how to cure local diseases, we have to understand this thing. Because many times, for rashes, we are giving just sulfur or some other medicine which has action, some silicea, for calcarea sulfur for the boils or this thing. That is not going to do any improvement for a long time in the patients. We have to go inside, we have to see what is basically affecting this thing, how this patient is sensitized. We'll go into more further details when we go in the next class. So no eruption on the lips, no whitlow can occur without previous and simultaneous internal ill health. Even the smallest of eruptions, some white discoloration, some vitiligo, it can never come without previous, or at that time also there is patient or organism is having internal ill health. The signs or symptoms may be slightly visible, may not be visible, but there is something going on which we have to find out. All true medical treatment of a disease on the external parts of the body that has occurred from little or no injury from without must therefore be directed against the whole. So when some disease is coming on the external parts, not due to some injury, whenever some disease is coming from internally, so the whole treatment, the whole medical treatment should be directed to that whole internal disease, must affect the annihilation and cure of the general malady by means of internal remedies, not external remedies. We have to give internal remedies. We have to give medicines which cure from the inside. If it is wished that the treatment should be judicious, sure, efficacious, and radical. So if we need a treatment which is sure, which is efficacious, which is justified, and which is prompt, which is fast, we have to cure the patients like this. There is no other way. So with that, we will stop today's this class on Organon. So just go back when during this 1 week, think about the skin, because it is very important. What do you feel from your skin? The temperatures, the pressures, the proximity, the spatial recognition, whatever you feel, whatever you sense, you feel through your skin, through your senses. Then you can go more deep on your senses, on with your eyes. 60 to 70% information which we get from our skin and eyes, these two organs. Okay, the unconscious information is coming from the skin part. For right now, for example, I'm sitting in this air conditioned room, I can feel on my skin that coldness which is being produced. My body is getting that information and reacting in the way that it is feeling, little cold or little this thing. And then the eyes, just you close your eyes and you get relieved from around 40 to 50% of the problems in your life. You see someone you don't like, you see something you don't like, you see there are so many things to be done, you see so many problems in front of you, you just close your eyes and you are relieved. So that is the part which is affecting us. So if we need to understand how the patient is getting affected, we have to see that how my skin and my senses are basically in a way affecting me also. They are very important part of our life. They are very important, but they are being misused by the learned intellect. Most of the time we say these things, I cannot see this happening. So when some information is going inside me through my eyes, through my skin, which I am not liking, so obviously it is going to, create some turmoil inside. It is going to create some problem inside me. So the whole will agree with that thing, that yes, not only the eyes, not only the brain, but the whole body does not like this thing happening. You will start feeling something around your stomach. You will start feeling some jitteriness, some anxiety in your body. If it is thing to be produced, anger must be produced, then you will see, for example, the children, they have, not kept books properly or the clothes properly. The mother comes, she sees that thing, she starts feeling in her whole body that anger. So the eyes are not getting angry. The brain is not getting angry. The anger is felt in the whole body, but from where the information came? From the eyes. The eyes played a role. The skin played a role in that part. So it gets more deeper than the separation thing. It is more about how I am percepting my reality through my these senses. And that is the cause for why this part it starts getting affected. Why our senses get affected, why skin gets affected, why the eyes get affected. So we'll try to go more deeper into this part in our next class, and how to cure that thing, how we have to understand it, and how to go more deep into that understanding, so that we can come up with a medicine which can cure these local diseases. And then you will be very surprised to see that after the local diseases, mean skin diseases, the next one-sided diseases are the mental diseases. So very connected, because mental diseases are again the diseases where the reality is compromised, where I am perceiving completely different things, some schizophrenia, some bipolar manias, again the whole reality is compromised. I'm not seeing, feeling, hearing, looking at the things as they are. So we'll go, it is very interesting part of this organon. The whole organon is interesting, but here, because when we are talking about how to cure them, it becomes more practical. So I will take your leave now. We will see each other next Wednesday, and then we will more discuss about this thing. Thank you so much.